Breaking news, unveiling the first comprehensive guide for stomach cancer radiation therapy. Arlington, Virginia, November 18, 2025, the American Society for Radiation Oncology, ASTRO, has taken a monumental step forward in the fight against gastric, stomach cancer with the release of its inaugural clinical guideline. This guideline, published in Practical Radiation Oncology, is a beacon of hope and a comprehensive roadmap for healthcare professionals and patients alike. The global impact of gastric cancer. Gastric tumors pose a significant health challenge, ranking as the fifth leading cause of cancer incidence and death worldwide. With an estimated 30,000 new diagnoses among American adults in 2025 alone, the need for advanced treatment strategies is evident. While stomach cancer rates have generally declined over the past half-century, recent studies suggest a potential increase among middle-aged adults, underscoring the urgency for innovative approaches. A decade of progress in gastric cancer treatment. The past decade has witnessed remarkable advancements in gastric cancer treatment, driven by breakthroughs in surgery, chemotherapy, immunotherapy, and radiation therapy. For patients with resectable disease, perioperative chemotherapy regimens administered before and after surgery have shown improved survival rates. Furthermore, emerging evidence highlights the additional benefits of incorporating immunotherapy into these treatment protocols. For patients who cannot undergo perioperative chemotherapy, a preoperative chemoradiation approach offers a promising alternative, providing good local control. Additionally, definitive chemoradiation presents a non-surgical option for those who are medically inoperable or decline surgery. Radiation therapy also plays a crucial palliative role, alleviating gastric cancer-related symptoms such as bleeding and pain, thanks to newer techniques that enhance precision and patient tolerance. The evolving role of radiation therapy. Christopher G. Willett, M.D., ASTRO, Chair of the Expert Panel, and the Mark W. Dewars Professor of Radiation Oncology at Duke University, emphasizes the complexity and multidisciplinary nature of gastric cancer management. He highlights how the role of radiation therapy has evolved over the past 2 decades, requiring dynamic integration with surgical, chemotherapy, immunotherapy, and palliative care modalities. Christopher J. Anker, M.D., Vice Chair of the Expert Panel, and a Professor of Radiation Oncology at the University of Vermont Cancer Center, adds that while other societies have published guidelines for treating gastric cancer, ASTRO's guideline is the first to comprehensively clarify the role of radiation therapy across all disease stages. It provides patient-centered, evidence-based recommendations to guide clinical practice, ensuring that patients receive the most appropriate and effective care. Key recommendations for resectable and unresectable disease. The guideline offers detailed recommendations for both resectable and unresectable gastric cancer cases. Resectable disease, surgery and perioperative chemotherapy, fluorouracil, oxaliplatin, and docetaxel, FLOT, given before and after surgery, are recommended for patients with resectable gastric cancer. Pre-surgical radiation therapy with concurrent chemotherapy is advised for those ineligible for perioperative chemotherapy, aiding in achieving negative surgical margins and reducing early recurrence risks. Pre-surgical chemoradiation may also be added to perioperative chemotherapy for borderline resectable tumors to improve the chances of complete cancer removal. Unresectable, locally advanced or metastatic disease. Definitive radiation therapy with concurrent chemotherapy is recommended for patients with non-metastatic gastric cancer who decline or are not candidates for surgery. This approach may also be considered for patients with inoperable recurrent gastric cancer if the recurrence is localized or locoregional and no prior radiation therapy was administered. The guideline includes a treatment algorithm for managing locally advanced disease. Palliative radiation therapy. For locally advanced or metastatic cancer that cannot be surgically removed, palliative radiation therapy is recommended to alleviate symptoms such as bleeding, pain, and obstruction. Reirradiation may also be considered in the palliative setting for certain patients. Metastatic cancer. For cancer that has metastasized to a limited number of sites outside the stomach, the guideline conditionally recommends radiation therapy or surgery for all visible metastases combined with systemic therapy. It also reviews the role of radiation therapy to the primary tumor for patients with stable or regressing metastases to help control symptoms. Optimizing treatment planning and delivery. The guideline provides recommendations for optimal dosing and fractionation approaches for different stages of gastric cancer, aiming to maximize precision and minimize side effects. It also discusses best practices for treatment planning and delivery of definitive and palliative radiation therapy, incorporating newer techniques like intensity-modulated radiation therapy, image guidance, and respiratory management to enhance treatment tolerance and fidelity. A collaborative effort for patient-centric care. Radiation Therapy for Gastric Cancer, an ASTRO clinical practice guideline, was developed by a multidisciplinary panel comprising radiation, medical, and surgical oncologists, a radiation oncology resident, a medical physicist, and a patient representative. The recommendations are based on a systematic review of research published from 2001 to mid-2025. This guideline was developed in collaboration with esteemed organizations such as the American Society of Clinical Oncology, the European Society for Radiotherapy and Oncology, ASTRO, and the Society of Surgical Oncology, SSO. It is endorsed by ASTRO, SSO, the Royal Australian and New Zealand College of Radiologists, and the American Radium Society. ASTRO's clinical guidelines serve as tools to promote individualized, shared decision-making between physicians and patients. They are intended to guide clinical practice, but should not be viewed as strict protocols that supersede the informed judgments of individual healthcare professionals and patients. Patient resources for informed decisions. For patients seeking information about treatment options, ASTRO provides a wealth of resources through rtanswers.org. These resources include general information, videos, and PDFs covering various aspects of radiation therapy for esophageal and stomach cancers, ensuring patients are well informed and empowered in their healthcare journey. About ASTRO. The American Society for Radiation Oncology, ASTRO, is a global leader in radiation oncology, with a membership of over 10,000 professionals, including physicians, nurses, physicists, radiation therapists, dosimetrists, and other specialists. ASTRO is dedicated to advancing radiation oncology through clinical care, research, education, and policy advocacy. Radiation therapy plays a pivotal role in cancer treatment, contributing to 40% of cancer cures worldwide, with over 1 million Americans receiving radiation therapy for their cancer each year. To learn more about ASTRO's mission and initiatives, visit their website and media center, and connect with them on social media.